Hello dear patients, today we are going to review the case of crack on a man's foreskin. A man came to us, he only had sexual contacts with his wife and he had no other sexual contacts. Without any apparent causes, as he didn't have allergies before, cracks and reddenings on foreskin developed. They were accompanied by tenderness, itch and burning. You can see it on the picture. In the beginning he went to his dermatvenerologic dispensary at the place of living, where a diagnosis of candidosis was set. No other diagnoses are usually set. Clotrimazol cream was prescribed externally. It only worsened such cracks. They started to burn harder. They increased in size, and after being disappointed, he came to us. No analyses for candidosis were taken. Then he came to our clinic. Preliminarily, we advised him to use ointments, and he did that by the visit to a doctor. Then we took analysis from the surface of these rashes for candida, the one that had to be taken initially, culture test for bacteria and candida, and analysis from inside the canal, and externally for sexually transmitted infections. We took analysis only for the main infections, as there's no need to check for HPV, for example, as it doesn't relate to such cracks. All sexually transmitted infections, including candida, were negative. Bacteria were also within norm. After that, analysis for allergy were taken. You can watch a separate video on our channel about what it is. Eosinophilic cationic protein was increased, and also it has to be said that analyses were taken for sugar and glycated hemoglobin that were normal. This rash is a toxico-allergic reaction where eosinophilic cationic protein is increased. This may be due to different irritants. Why does it localize on penis for the first time? That's usually because the skin is quite thin, irritable, and often manifestations of it on penis are the only symptom of such reactions. By the way, eosinophilic cationic protein was increased threefold to normal. Here, during such an index, the treatment is quite long. Patients coming to us want a fast treatment. They want some ointment to be used and leave. Here, when toxico-allergic reaction goes, a vicious circle is formed. He was consulted by immunologist, etc., and together with what immunologist prescribed, we prescribed sodium thiosulfate intravenously, calcium gluconate intramuscularly. Immunologist also prescribed hormonal medications in short courses. We also prescribed different softening medications such as Rodavit and Videstim. External hormonal ointments here have to be prescribed with great caution, because in our videos we have several times showed erosions from hormonal ointments. Here it's particularly dangerous, as cracks are there already and it's easy for them to be formed to erosions. Here we may try such cream as Elidel, and it was done. This is a non-hormonal anti-inflammatory cream, etc. So here the therapy is quite long-term for getting out of this situation. It took about a month in our case. The patients often do not understand that, as they were prescribed some magic ointments and they wonder why they don't get out completely healthy. Unfortunately, allergy can be acute, and there may be toxico-allergic reactions, including the ones on sexual organs, that manifest for a long time. It's good that the patient wasn't using hormonal creams for a long time, as this can happen quite often. This all resolved not earlier than 5 weeks. That was the time required for complete resolution of such process. So here injections have to be done for quite a long time and observation is needed, etc. So in some cases such skin rashes on genitals have a chronic cause, and I am not 100% sure that circumcision, etc. would help somehow in the beginning. Urologists do not perform circumcision until inflammation is not completely gone, the one that we see in the basis of such cracks, as it's not completely clear how they are going to heal. So such toxico-allergic reactions are quite common on sexual organs, and in some cases they have a very resistant cause. If it's necessary to diagnose and treat any rashes in the area of sexual organs, you can consult dermatvenerologists and venerologists of our paid medical center of dermatvenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic.